Hello, and thank you for joining us for the Using PSYCKES for Clinical Care and Care Coordination training. My name is Kristen McLaughlin. I'm the Director of the Medical Informatics Unit for the Office of Population Health and Evaluation. And I'm joined today by my colleague, Corin Smith, who will be assisting me in answering any questions that come up during from today's training. Today's training was a request from the Division of Integrated Community Services for Children and Families to display how to use PSYCKES not only for clinical care and care coordination, but also for population health. And that's the training webinar we're going to be hosting next week. So before I get into today's agenda, let's talk about how to ask questions during today's training webinar. All right, so as you probably noticed, all phone lines have been muted to prevent background noise, but if you do have a question, you can certainly ask it utilizing the Q&A box in the WebEx menu, and it's located either to the right of your screen, or if you've expanded to the full screen, you'll just need to hover your cursor over the green bar located at the top and select Q&A from those options listed in that menu bar. You'll type your questions using the Q&A feature to all panelists, which is the default. And we do ask folks not to use the chat function for Q&A, as that will not be monitored. We do have well over 100 or so odd people registered for today's training. So when it comes to questions, I'll probably save those for the end of today's training. So we'll go through all of the slides and we'll make sure to leave room to ask questions. If we cannot get to your question during the time frame left at the end, please know that we're going to be taking all of the questions from the Q&A box. We're going to download those and we'll be able to respond to you, if not live on the webinar, afterwards via email. Speaking of email, we're going to be making sure to send the slides as well as today's recording to all attendees after the webinar, and we will be posting it on our website at a later date. So we will be sending out the slides and the recording probably sometime early next week. All right, so let's talk about the agenda for today. So today's training, as I mentioned, is part of a series in which we worked with the OMH program staff, Meredith Ray-Labatt and Sarah Chiarcos, to identify how children's programs can utilize PSYCKES in their work with children and families. So today's training is going to be covering the clinical care and care coordination, and that includes levels of access to a child's data, how to look up a child in recipient search, and the information available in the client-level clinical summary, including information on mental health and medical diagnoses, medications, health home care management, children's HCBS or CFTSS services, outpatient hospital treatment quality flags, risk factors, et cetera. And then we'll make sure to save some time towards the end to discuss the training and technical assistance that PSYCKES has available, as well as leave room for question and answer. All right, so without further ado, let's discuss the overview for PSYCKES. For those of you who may not be as familiar with the application, the PSYCKES application is an online web-based application that can be accessed on any internet browser, and that it's secure and HIPAA compliant. And the main purpose of the PSYCKES application is for sharing data, so sharing Medicaid claims and encounter data, as well as other state administrative data. So what does PSYCKES do with all of this data? So it puts it into a user-friendly format, and it's made to design, or it's designed, I should say, to support clinical decision-making on that individual level, as well as quality improvement on more of a provider population trend level, because you can use the data that's collected in the application to make plans or identify particular problem areas. And this is another thing to keep in mind when you're thinking about PSYCKES are the updates. So we update the clinical summary, so that's that individual level report on a weekly basis, whereas the MyQI report that is containing the quality flags, that's going to be updated on a monthly basis. All right, so now that we know what PSYCKES is, who of my clients would be viewable in PSYCKES? So in order to be in the PSYCKES application, an individual needs to be a Medicaid enrollee, either currently or in the past. And the thing to keep in your mind when you're thinking about currently or in the past is that those people who are currently uninsured may have been enrolled previously in Medicaid, so once in, always in. And when we're saying Medicaid enrollee, that also means across all categories, including fee-for-service and managed care. The application also includes dual eligible, so Medicare and Medicaid clients, for example. But if Medicaid pays for any part of the service, that's what the information is going to display. because Medicare services will not be displayed in the application. We're hoping to add that as a data source in the future, though. So in addition to being a Medicaid enrollee, in order to be in PSYCKES, an individual needs to be considered a member of the behavioral health population. And in this webinar and throughout PSYCKES, when we're saying behavioral health, that means that the individual has one of the following: a psychiatric or substance use service, a psychiatric or substance use diagnosis, or it's been prescribed a psychotropic medication. But this doesn't mean just because this information is about the New York State behavioral health population doesn't necessarily mean that we're limited to just behavioral health information. This is going to include data across the treatment spectrum, and my next slide will go into more detail about that. So what data is available in PSYCKES? So as I mentioned, that clinical summary, that individual report provides up to 5 years worth of data, and it's updated on a weekly basis. So what makes up the clinical summary? So the client information comes from two different, what we call data source buckets, right? So one is going to be the billing. That's the Medicaid fee-for-service claims and managed care encounter data across treatment settings. That includes medications, medical behavioral health outpatient and inpatient services, ER utilization, care coordination. If Medicaid pays for it, we'll be able to display it. But we also have another data source, which is information from other state administrative databases. So before I go into what those are, I do want to talk or touch briefly on the Medicaid billing. So the Medicaid billing bucket, that is our largest source of data, but it also has a time lag that you should be aware of. So the time lag in PSYCKES can vary depending on a couple different things. So first, it's going to depend on what type of information. So something like pharmacy claims, those are considered pretty quick and timely. That can be within 30 to 45 days from when the prescription is picked up by the client at the pharmacy to when it hits the application. Whereas inpatient and outpatient services tend to take a little bit longer from the time that the service occurred to the time that you see it in the application. On average, it's around 3 months, but again, it could be a little less or a little bit more. And that's going to depend on a couple different things. So first, it depends on how quickly and how accurately the providers are billing for their services. So the provider submits their bill and it goes to the managed care plan. Let's say the provider's billing practices, even if the service occurred in the very beginning of the month, if they don't submit their claims until, like, let's say the very end of the month, that's already adding 30 days. And it also matters how accurately the claim is, because if managed care plan boots it back to the provider, again, we're not going to be able to see that information, and it could be adding to the lag. Once the provider, let's say, submits to the managed care plan, it does take some time for the managed care plan to review the information and then submit to the Department of Health. So really, it does depend on how quickly and accurately these organizations are able to turn these bills around. But once the information is captured at the Department of Health, we get a weekly feed of their Medicaid data, and we put that into PSYCKES. So that's why we say the clinical summary is updated on a weekly basis, but it's something to keep in mind when you're thinking about the time lag is you have to wait until the data actually gets to the Department of Health. So that's just something to make note of. Whereas our other state administrative databases, those are considered our quote unquote real-time data sources. And we call them the real-time data sources because those have a lag of either 0 to 7 days. And as I mentioned before, we update weekly. So here's a list of some of those different types of data sources that we have. So we have information from the New York City Department of Homeless Services. So we have a direct link into their feed, and this is going to include shelter information or outreach information. We also have access to the state psychiatric center's EMR. So if they've had a stay at a state PC, we'll be able to see that in the application. If somebody has ACT provider contact information, we'll be able to display that, as well as the AOT provider contact information. If someone's enrolled in a health home or care management agency, we'll be able to display that as well as their contact information via the MAP portal. Suicide attempt information. So this is something that's a little bit, this is a type of data source that we have, and it's from the state's incident management system called NIMERS. And what's great about having a data source directly from the incident management system is that we don't have that finite 5-year look back like we do with Medicaid claims. So if a suicide attempt was inputted into NIMERS 5 years ago, 10 years ago, 12 years ago, that information will still display in PSYCKES because we have that direct source. We also have the managed care plan and HARP status. And then we also have safety plan screenings and assessments by clients or providers that have been entered in either by My Choice or the iOS app, and then the managed care plan assigned PCP. And this list is constantly growing, so it's always a good idea to check in with PSYCKES to see what new data source we might have available to our users. All right, so let's talk about what the quality flags are, or what the quality indicators are. So PSYCKES identifies clients flagged for a particular treatment concern or medication adherence issue in order to inform the treating provider and help support clinical review and quality improvement. And something to keep in mind about quality flags is that when a client has a quality flag, we have about 80 in the application, the provider is allowed to access the individual's clinical summary. It's not going to be the all available information, and we're going to go into the different levels of access in a little bit later on in today's training, but that's just something to note. If that person has an applicable quality flag, the organization may be able to view their clinical information. So what are some examples of current quality flags, especially in relation to children? So we have the vital signs dashboard for the child population. So if they haven't had a well care visit in the past year, or if they haven't been immunized for HPV, for example, that's an example of a flag. So that's something that can be brought to the provider's attention. If there's medication related, so if there's been no follow-up for a child that's been placed on ADHD medication, that's something that someone can get flagged for. Acute care utilization, so if a child is, going to the ER or inpatient, more 2 or 3 times a year, that's something that's going to get flagged. Or if they're cycling in and out of a hospital, they get discharged from a hospital and then within 30 days they're back in another hospital or the same hospital even, that's something to flag. So here's just a couple of those examples in regards to the flags. So what types of reports are available in the application? So as I mentioned, we have the client clinical summaries, which show the individual client data for up to 5 years. And it's our most popular PSYCKES report. But we also have the provider agency level reports. So the recipient search reports can be used to identify cohorts of interest, so to support the population health. So if you want to see which of my clients are eligible for Health Home Plus, or which of my clients have this diagnosis, these are things that you can run in the recipient search. We also have the MyQI reports, and that can be seen at that provider level, where you're able to see the prevalence rates on all of our different indicators and then compare your performance on all of those quality indicators, as well as drill down to the client level views to see which of my clients are actually being found positive for such a flag. The PSYCKES usage reports, I wanted to mention this specifically because if you're somebody who's on the call today who might not be as familiar with PSYCKES, or you want your organization, some of your staff to start utilizing PSYCKES more, you have the ability to use the PSYCKES usage reports to help monitor not only PHI access by staff, but making sure staff are even logging into PSYCKES. That saying, if you don't use it, you'll lose it kind of thing. That's an example that we can utilize with PSYCKES as well. It's really important to make sure that if you are expecting your staff to be able to use PSYCKES, that they got to be logging in, right? So that's a place that you're going to be able to identify that. And then utilization reports we have to support provider value-based payment data needs. And then statewide reports, this is where you can do comparisons, not just across the region or the state, but also by county, by specific plan, by a network, even by another provider. So if you want to compare yourself to another provider, you have that ability, especially across the specific QI flags. You can do so in the statewide reports. Now, for today's training, we're really going to be focusing on this top bullet here. And I think I even have, a little identifier here. And then during our next training next week, we'll go into more of the provider agency reports that are listed below. All right, so let's talk about access to client data. Now that we know what kind of data is available, how do I, as a PSYCKES user, get access to it? So there are 2 ways that clients are going to be linked to you as a user at a particular provider agency or even a hospital. The first way is automatically, and these clients for whom your agency has billed Medicaid in the past 9 months and are positive for a quality indicator will be included in this automatic linkage. An agency's PSYCKES QI reports will include information on clients up to 9 months after the last billed service, and the 9-month look back is used so clients aren't bouncing on and off the QI reports due to temporary breaks in care. So you can access client level data, like I was saying before, if you've billed for them in the past 9 months and they have an applicable quality flag. The second way, so that's automatically through billing. The second way is manual. So this is done through the Enable PHI Access module, and there's a couple different ways that this can be done. So first is through a signed consent. You have the client sign a signed consent, and if it's the PSYCKES consent, we have that available not only as a physical consent that someone can sign, but we just added this new feature just a couple weeks ago to our iOS mobile application, where folks are able to do an e-signature, and that's like giving you more of a streamlined process. So you can have the client sign the PSYCKES consent form on your phone or on your iPad, and then that's also attesting that the consent was done. So that's just one thing I wanted to mention in this group, especially if you're meeting people out in the community. The PSYCKES iOS app might be a great option for you. We also have the clinical emergency, the break the glass situation. So if there's a clinical emergency, this person is in imminent risk of harming themselves or others, you can break the glass in that situation. We also have the verbal PSYCKES consent, and we're going to touch base on a little bit more of this. So the verbal PSYCKES consent is that you couldn't get a physical signature, but the client themselves said, I verbally give you consent to view my information. There's a couple different things that you would have to keep in mind. It's not the same as if you got a physical or e-signed consent. And then lastly, the ability to attest that the client is being served. So you haven't yet, you could have either not billed for them yet, maybe it's their first time that they're coming into your agency, or you don't want to have to wait the 3 to 4 months for that automatic billing to occur, because as we remember, billing can take some time, there's timelines. You have the ability, if the person hasn't signed the consent, it's not an emergency, you have the ability to say that I'm either being served, I'm either serving this person or they're about to be transferred to my agency. And then you can use that in the recipient search to manually link clients in addition to the registrar menu. So what kind of access am I going to have if I don't get a signed consent for my client? So certain data will be provided without a signed consent. So as I was mentioning before, the client would have to be positive for an applicable quality flag, as well as have at least one billed service anywhere in your agency in the past 9 months. If those two conditions are met, you're going to be able to drill into that person's clinical summary. And the rationale is to help monitor the quality and the safety of the Medicaid program. So if you see that your client is having, is on 2 or more antipsychotics, 2 or more antidepressants, it's helpful to know that that flag's there, but also you'd want to be able to drill in to see which of these medications, who are prescribing them, right? So that's the rationale. But because you don't have a signed consent, you're not going to have available to you the protected health information. There are enhanced protected health information, also known as EPHI, that have special protections. And that includes substance use information or treatment, HIV, genetic testing, or reproductive or family planning. So without client's consent, you will not be able to see those types of information. And again, you're only going to have access to the client data as long as the bill was within the last 9 months and that applicable quality flag they're so positive for. So that's just something to keep in mind. With signed consent, though, that gives you a little bit more of an expanded access. So here you have the ability to search among all Medicaid enrollees in the behavioral health population, including those who are not yet linked to your agency through Medicaid billing or are not positive for a quality flag, right? So if you haven't billed for this person yet, or they're not positive for a quality flag, but you still want to see what their clinical summary has, that's when the signed consent is definitely going to come in handy. And the signed consent includes information with special protection. So if you get a signed consent, you get access if the client has any substance use, HIV, genetic testing, or family planning, you're going to be able to see it. Whereas the quality flag level of access, that information would be hidden. The other thing to keep in mind with the signed consent is that that's giving you access to this client's information for the longest period of time. That's going to allow you access to this client's clinical summary for 3 years after the last billed service. So when you think about it, if you're going to continuously see this person and you're billing for your services, right, month after month, that 3 years keeps getting pushed further and further into the future. And the great thing about the clinical summary is that it's not just one static document. It gets updated, as we mentioned, on a weekly basis because there could be new services or medications coming in. So that's the great thing about the signed consent is that you're going to be able to access this person's information for a longer period of time and get the fullest picture of this client's utilization and medication adherence. So access to client level data with that special protection is going to occur with a signed consent or if there's a clinical emergency. If you're attesting that this is a clinical emergency, this person is in imminent risk of harming themselves or others, you are able to, quote unquote, break the glass and attest that this is a clinical emergency. This will give you access to all available information, including that specially protected information, but it will be for a limited duration. You'll only have 72 hours from the time that you attest that this is a clinical emergency to view the clinical summary and get the information that you need. Once those 72 hours elapse, you will not have the same level of access to that client. So I think we talked a little bit more about those advantages. So again, access to data remains in effect until the client is, discharged, which is usually we'll have a 3 year after the last billed service, or if the client withdraws consent. That is always something that the client has the right to do. If they sign a consent with you, they have every right to always withdraw their consent. So this is just a helpful little chart. And as I mentioned before, the recording and the slides are going to be sent to all attendees who are here today. So something just to keep in mind is this could be something that you print out and have available to you or keep somewhere where you can access this, because this will give you the different ways that clients can be linked to your agency, the type of access, if a quality flag is necessary for you to be able to view, what data you have available, the data with special protections, and for how long. All right, so now we know the different levels of access. Let's talk about how to actually go ahead and enable that access. So the first step is to search for the client, right? And we always suggest using unique identifiers such as a Medicaid ID or a Social Security number, because that's usually going to only pull back one person versus a combination of name and date of birth, right? There could be multiple John Does or Jane Smiths, right? So that's why we always recommend doing a unique identifier if possible, but you do always have the option of using a combination of name and date of birth. And we always suggest searching the full database because they might not yet be linked to your agency via billing at this time. All right, so now that I'm able to search, I wanna see who I pull back. So using my fake Medicaid ID number here, I can see that John Smith has been identified. I would review this information to make sure, yep, this is the right John Smith. That's his Medicaid ID, that's his date of birth, this is where he lives, all of this looks right. And then I see here that this is in red, meaning that I have no access. And that's what you can see in this column over here, current PHI access. So if I do want to enable access, I have the ability to right here in this far right column. Once I should also mention, this is what happens when you put in a criteria that isn't unique enough, right? So John Smith is going to pull back a ton of different recipients. So we give you tips on how to modify your search. All right, so once you enable access, you have options here. So why are you allowed to view this data? So this is when you're gonna have to, you're asking yourself, okay, so why am I allowed to view this information? So the first bucket is the client signed a consent. All right, so what consent did the client sign? Did they sign the PSYCKES consent? Did they sign a BHCC patient information sharing consent? And this is a very specialized consent form that BHCC network users have. So providers within the network may have their client sign the BHCC patient information sharing consent form, because then that will allow their information not only to flow up to the network lead, but also to the other providers within the network. So that's why this is listed here. And we also have the DOH Health Home Patient Information Sharing Consent. So for any folks on the line who are part of a health home or care management agency, and you have, as per your policies, you always make sure to have, clients signing the DOH Health Home Patient Information Sharing Consent. If that's been done, you can come into PSYCKES and enable that right in here. So that's the first bucket, if the client signed the consent. If the client did not sign the consent, then you have the provider attest to other reasons. So client gave a verbal PSYCKES consent. And again, giving a verbal PSYCKES consent is basically allowing the same access as if you had a quality flag level of access. You'll still be able to drill into the clinical summary, but you're not going to get the enhanced PHI information. So that's just something to keep in mind. There's also, this is a clinical emergency. So this person is in imminent risk of harming themselves or others. So I'm going to break the glass and have a limited duration to view all available information. If the person doesn't hit any of the above criteria, you have also the client is being currently served by or being transferred to my facility. So there's not a consent, there is no emergency, but I do want to see if there's an opportunity for me to be able to drill into their clinical summary to see if they have some information, and I don't want to have to wait for the billing to come through and they happen to be positive for an applicable quality flag. That's when this last option can come into play. But let's say for this example today, because PSYCKES consent is the gold standard, right? Consent is always the gold standard. I'm going to go ahead and select that. The next screen is going to, and this is the PSYCKES consent form for those who do not know. Something I want to point out is that, especially for the children, you have the ability to either have the patient sign or the patient's legal representative. So we do have that option within the consent. All right, so the next step is to confirm the identity. So I gave the reason for why I'm allowed to view the information. The next question I need to ask is, how do I know this person is the John Smith that I'm supposed to be able to view? So you have either the provider attest the client identity, maybe you're familiar with John, you've worked with him for a long time, you know this is the John Smith, you have that option. Or if the client provided one form of photo ID or two forms of non-photo ID, then I could also utilize that second radio button below there. You'll see on the screen the level of access and how long you're going to be given data for. So here for Main Street Clinic, I'm going to get access to John Smith's information, all available data for 3 years, and it's going to renew with billed service. So once that's done, the last step I have is to either enable, if I'm doing a few consents at a time, I might want to enable and just go back to recipient search, or I could want to enable and view the clinical summary. So now let's talk about the clinical summary, because this is what's going to have the lion's share of information about a client. So as I mentioned a couple times, it's refreshed on a weekly basis. And it's going to provide 5 years worth of information across treatment settings. So here's just some of the examples that we'll have. You're going to be able to get managed care plan information, whatever their product line is. If they have a PCP for care coordination information, you're going to be able to see the health, home, or care management details. If they have any children waiver statuses or services, OPWGD NY START eligibility, or if they're part of the On Track New York Early Psychosis Program. You'll be able to see alerts. So if they've had any suicidality or overdose information or homeless services, that will be available in the alerts section, whatever their active quality flags are. If there have been any plans or documents uploaded to their clinical summary, or any screenings and assessments that have been done, for example, the suicide screening or the depression screening, any of their mental health or medical or behavioral health diagnoses for diagnoses or medications, any of their outpatient services, as well as any of their hospital ER and crisis services. So let's talk about the viewing option. So you're going to default to the brief overview. And the way that we think about the brief overview, it's like almost like a cover page to the rest of the clinical summary. That's going to provide you the most critical information in really an easily identifiable form. And it's only going to be about a page or two. And it helps to optimize time when reviewing a clinical summary to get that full clinical picture. And then you have the option always to change your view to the 1-year summary or the 5-year summary, right? So the brief overview kind of gives you the highlights of that person's clinical summary, and then you have the ability to drill into those different sections to get more specific details about those services or medications. All right, so this is what the brief overview looks like. So here you'll scroll down on the page, but you'll see here's like the general section. So you'll see like here's where the children waiver status would be up at the right here. You see what their current care coordination is. So you can see that they're enrolled in a health home. They're considered a high mental health need due to having a hospitalization within the past 12 months that had related to suicidality or self-harm. You also see that they're eligible for an OPWDD NY START program. You can see any of their alerts. So we see that there has been some suicidal ideation in the past. You can see what their active quality flags are, as well as what their diagnoses were. And these are separated into behavioral health and medical, as well as what the most recent diagnoses were in the past year, as well as what the most frequent were. So sometimes those don't always match. And then if you keep scrolling down, you have the medications. So whatever medications this person has been prescribed in the past year, any of their outpatient provider information that you can see here. So we're seeing like they've had CFTSS services, children HCBS services, and then lastly, we have the all hospital and crisis utilization over here. So that's the brief. This is just giving you a flavor of what's going on. You also have the ability to see about the included data sources. So if you're interested to see like where are we getting this data from, we have this really great PDF that you have the ability to view all the different sections, where it's coming from, when it's updated, and what's it going to include. All right, so I'm going to switch over to what the 1 year and the 5 year look like. So here and on the far right, you can see that I have consent because I'm able to see all available data. But if I ever wanted to share some information that didn't include the special protection, I could always choose to hide that. But that's something just to point out here. But in the general section, you're going to get information like client name, date of birth, address, Medicaid ID, if they have an eligibility criteria, their managed care plan, if they have a managed care plan PCP. And then at the far right, like I pointed out before, we have the children waiver status, if applicable, and then the HARP HCBS assessment status. Underneath that section are going to be the current care coordination section and the alert section. So some of the information, if applicable to the client, is going to include their health home outreach and enrollment, care management agency outreach and enrollment, On Track New York early psychosis program enrollment, if they are eligible for OPWDD NY START, and if they have a Medicaid eligibility alert. So if they have to use the New York State of Health alert for Medicaid recertification, that's going to be listed here. Also, if they've had any alerts, and that's coming from both NIMERS, that incident management system for the state, as well as Medicaid data. So that's including the suicide attempts, ideations, harm, poisoning, overdoses for opioids, and homelessness. So let's take a look at what that looks like. So here's the current care coordination section, and we call it, it has two different functions. It's the who do you call list and what are you eligible for list. So this is giving you the who do you call information, right? Like, so we can see this person's enrolled in this health home and has this care management agency. We also see that they are considered a high mental health need. And then we see this is their eligibility here. So we see that there's a Medicaid eligibility alert as well as an OPWDD NY START eligibility. And then we can see that they're also enrolled in the On Track early psychosis program. Keep scrolling down. So as I mentioned, the alert section contains information on suicidality, on homelessness, and if the person's had any positive screenings or assessments, and opioid overdose. So one of the things I do want to mention in regards to this section is that things like the suicide screen and the depression screening, those are considered enhanced PHI. So this is something, for example, where you will not be able to see the high risk or the results of these screenings unless you do have a consent in place. So that's just something to keep in mind, and just one other shout out, I guess, to get consent when you can. But here's where this information lives. You can drill in, and you can also see details in a chronological form. The next section is something that was just added to the application this month, and that's the social determinants of health. And this includes social and environmental conditions that impact a wide range of health risks and outcomes. And this is information that we're getting from the Z codes and Medicaid billing. So here's an example of someone who's had either problems related to education and literacy or problems related to upbringing. So these are the domains, and then over here are the actual conditions. So let's say, for example, I'm interested to see, well, what were the services that were associated to someone saying that this person's having other problems related to education and literacy. So you can click on that, and very much like the diagnosis section, you can see the date of service, the service type, the service subtype, the provider name in which that social determinant of health was given, and then any other primary, secondary, or quality flag related diagnoses. So we can see that during this visit to Bronx Care Hospital, this person was diagnosed with anxiety disorder, as well as having other problems related to education and literacy. All right, keep scrolling down and we'll have the quality flag section as well as the PSYCKES registries. And the PSYCKES registries are something that some agencies have access to within the My Choice side, and they're able to place people on certain registries that they either consider to be high risk or that they would like to place on their suicide care pathway, or who are part of, like, who might be in the COVID-19 registry. And that's mostly the COVID-19 registry is saved for the state PCs. But we can see here that for the PSYCKES registries in this, this instance, that St. Lawrence PC placed this individual on their suicide care pathway twice. They were originally on until January 15th, and then they were taken off. But then they were re-added back on 1/23, and that's considered active. So you can see here, and the reason why is because they did have a suicide attempt indicated in NIMERS. The quality flags, if you want to view the quality flags and have some questions like, I don't know what the, the specifications are, the description of what a no follow-up after MHED visit means, you have the ability to always select the definitions up at the top here, and that'll pull out a PDF. Underneath that are the plans and documents and the screenings and assessments. So in the plans and documents, you have the opportunity to either create a safety plan using the Stanley Brown template or a psychiatric advance directive using the NIAPRS template. So that's what you can create. But you also have the ability to upload. So if you have other documentation like a care plan or a discharge plan or a relapse prevention plan, that's something that can be uploaded here, and that would be available to any provider who's also working with your client and viewing them in PSYCKES and has a consent, because that's what you'll need in order to view plans and documents that have been submitted by other agencies. You'll need to have a consent in place. One other thing I'd like to point out is that the PSYCKES consent form, when it's been e-signed, will also be available in the plans and documents section. So that's how you go about giving a copy to the client who's e-signed the PSYCKES consent form. Underneath that is the screenings and assessment section. So there you can see in this case that this person had a suicide screen as well as a PHQ-9. And we can see that that was administered in the PSYCKES mobile app. So that's an example. Again, the screenings and assessments, if they're positive, they'll be listed above in the alert section. But if they're positive or negative, right, if they've just been conducted, they'll live in the screenings and assessment section, and you'll be able to see the last assessment results on the far right. But again, remember, if you don't have consent, you will not be able to see these results from other organizations. Continually scrolling down, the next section we have are the medical the diagnoses for both the behavioral health and medical. So you have these separated here, and these are going to include both the primary, secondary, and the quality flag related diagnoses, and they're going to be put in the order of most frequent first. So if I'm looking at this client's diagnoses and I want to know, well, who's been saying that this person's having an adjustment disorder, let's say, I have the ability to click on any of these diagnoses to see more details about that billed service. So just like we were seeing for the social determinants of health, let's say I'm interested to see who's been providing the diagnosis of adjustment disorder, what services are related to that. So here again, I see the date of service, the service subtype, the service type, the service subtype, the provider name, as well as any other related diagnoses. And you can see that for all of these different ones, and you'd have the ability to always export to PDF and Excel if needed. Underneath the diagnoses is the integrated view of services over time graph. So that's the IVOS. This is the only section that defaults to a graph view. Each of the sections have the ability to be graphed to see that visually. But here's an instance where this is one of the sections that automatically will show the graph. So it's basically your ability to view patterns of service and medication utilization visually to get a better sense of this person's either medication adherence or service utilization. So just looking at this, when we see a single dot, that's an individual day or pickup, for example, whereas here, continuous line means that's continuous coverage. So we can see that this person has been continuously covered for Medicaid since, before July 2018, so the last 5 years. But if I'm looking at this graph, maybe what I might be interested is when I'm seeing gaps. So here's an example. This person was going to the mental health specialty clinic for some time. And then there's been some gaps here. And these gaps have to do with some of the medications as well as some of those outpatient services. When I look below, once this person had stopped maybe going to their community providers or taking their medications as expected, all of a sudden I'm seeing ER and inpatient kick up. So that's a way for you to be able to visually spot like, oh, I need to get this person re-engaged back in, outpatient services or back to taking their medications, and that's just one example that you can use here. And you can see all the different types of services that they received as well as medication pickup. Below that, you have the care coordination section. And unlike the current care coordination section, this is going to include both current and historical information. So I can see that historically this person has been enrolled in a health home, and that's current. We can also see that they've had child waiver services in the past. So they had that back in 2022. The next section is the medication section, and those are broken up between controlled, behavioral health, and medical. So you have the ability on any of these medications, you'll see the drug class, the drug name, what their last dose was, what their estimated duration that they have been picking up that particular medication, and when the first day and last day of their pickup was. If you're interested to see more details, like if you want to see every individual pickup for a particular medication, you can do so by selecting the See Details button. All right, so when I select the See Details button, I'm seeing the orders, and the orders are those individual pickups. There, you're able to see the pickup date, the brand name, the genetic name of that medication, what the drug class is, what the strength is, how many was dispensed, how many days supply they had, how many tabs per day, what's the dose, how's the route, how do they take the medication, who prescribed the medication, even down to the pharmacy in which they picked it up. That's the ability of how you're seeing the orders. The trials is basically taking all of this information and trying to give you a trial for like the length of time that they've been on this medication. So for example, here, this has been for 4 months. If you're interested to learn more about the medication information, you have the ability to click on the medication itself, and you can look at dosing information, contraindications, any adverse effects. You have that ability using the Micromedex solution by selecting the drug name. All right, so this is an example of switching a view of a table to a graph. So those same medications that we were just looking at, you have the ability in the example here for the behavioral health medications to switch this to a graph. And sometimes the graph helps you more visually understand what their coverage was for their medication. So when you're seeing gaps, that means that they weren't covered for that time. Now, they may not have been prescribed that medication during that time, or they may not have been picking it up. So that's just a way for you to be able to visually see that. Underneath that section, we have the outpatient services, and those, again, are separated into behavioral health as well as medical services. So when you're looking at these outpatient services, you're able to see what the type of service it is, who the provider of that service was, when the first date that service was provided versus the last date provided/billed, the number of visits they've had for that service type and provider, as well as what their most recent primary diagnosis was and the most recent procedures. If you're interested, so a couple of the things that we wanted to point out here is, the CFTSS or the Children's HCBS services, those are going to be existing in the behavioral health services section. If you're interested to see more details, like I want to see each of the 5 visits that this person had for CFTSS in St. Dominic's home, I have the ability to come to the far right here and click on the See Details. There, I'm going to be able to see the date of service, the service type, the provider name, right? All of those things that we just saw on the previous screen. But the next thing I'm able to see is any primary, secondary, quality flag related to the diagnosis. So here it's a little bit different, where in the previous screen, you're only going to see the primary. Here you can see any other kind of secondary or quality flag information, as well as if there's any social determinants of health integrated into here. You also have the information for the practitioner, as well as any of the other procedures given. Here's an example if there's alcohol and or drug services provided. Just remember, if you don't have a consent, this is not something you would be able to see. All right, and then underneath that section is the hospital, ER, and crisis section. So here's this integrated view of behavioral health and medical for hospital, ER, and crisis. So in this section, you're able to see a service type, a provider, the admission, the discharge date or the last date billed, the length of stay, the most recent primary diagnosis, as well as any procedures. So going from left to right, you're able to kind of get a sense, again, of this information that they have. And then you can also see which ones are medical versus mental health versus crisis. And as just like we were seeing for any of the other sections, you have the ability to either drill in to see details, or you could drill in to see details in a chronological order for all of the hospital, ER, crisis. So instead of, you'd be able to see like all of the different stays here versus having them wrapped around into one. Continually scrolling down on the screen, we have some other sections. So dental and vision are only going to be if Medicaid, if we have details from Medicaid. So here's an example that this person did have some dental work, did have some vision appointments, and you can see the service type, the provider name, the first date and last date billed, the number of visits, and the most recent procedures during that visit. The living support and residential treatment, this is going to be a mixture from a couple different data sources. We're going to have Medicaid billing in here, but we're also going to have any OMH oversight housing information, and that's coming from CARES, as well as if this person had any shelter stay information. So this would be another example where you could see if they've had a history of a DHS shelter information here. So here's an example of just the program type, the provider name, first date of service, last date billed, and how many number of visits for living supports, really just how they go about billing for those services. So we can see that this person's in an ICF for IDD. So that's where they currently, well, not currently, but as of February 5th. Underneath that section, you have labs, radiology, medical equipment, and transportation. So something that I want to bring about with labs, we have the labs and pathology, and if it's coming from the Medicaid billing, then we won't have results because that's not part of the claims information. The claims information doesn't include results. But we do have access to what we were saying before, the state PC EMR information, and that also includes MARS and Cerner data. So what we're getting from Cerner is the ability to indicate lab results if a lab was conducted at one of the state PCs. So that's just one example of, the different data sources allowing for different types of information. So that's something to, just keep in mind when we're thinking about the lab information. If it's coming from Medicaid claims, unfortunately, we don't have the results. But if it's coming from the state PC, we would have results, and we would be able to show you what the results are, as well as what the normal range is versus abnormal. And we're hoping to add more lab data sources in the future. We also have radiology, medical equipment, and transportation. So these are all from Medicaid billing. So if we're able to display it, we will. If we don't have any Medicaid claims for that type of information, you'll see a message kind of that looks like this. All right, so that's the entirety of the clinical summary. So you can just glean, just from this training right now, just how robust and dense this information can be. So you have the ability to export this information. So if you want to export a PDF and put it into your EHR, or if you want to export to an Excel to do some more manipulation of some of the data that you're seeing there, you have those options. You also have the option, if you're exporting to a PDF, to include the brief overview as the cover page, and you have the ability to either export all sections, or if you only are interested in some of the selected sections. And if you are only interested in some of the selected sections for exporting, you have the ability to look at the summary data, which is what we were looking at on that main page, or those drill-ins, which would be all available data. You also have the opportunity to switch to your page orientation. So portrait is vertical, landscape is horizontal. If you select all sections, select all is the default here. If you want selected sections, you would just need to make your selected sections below and use the control key to select and unselect. When you're exporting this information, you have to make sure that you're saving to a secure server. This is just like any other protected health information. You want to make sure if this is a shared computer, that if you need to export this information, that you're also deleting it if it's shared, or keeping it in a very safe place. All right, so before I get to some questions, I want to talk about some of the training and technical assistance that we do offer as part of the PSYCKES application. So our website is a wealth of information, especially for resources and user guides about the application. So that can be found at psyckes.com or psyckes.org. So we have the PSYCKES training webinar. So we have live webinars like you're attending today that you can register for the PSYCKES training webinars page. So I know that the majority of people who found out about this training today got that blast email from NICTAC. But if you are interested in following up and learning more about the PSYCKES application, you have the ability to attend a live webinar by going to our training webinar page. Or if you're, the live webinars aren't a feasible time that you can join, we also save our recorded webinars, and we will be saving today's recorded webinar as well on our record webinars page here. And what are some of those recordings that are available? We have the introduction to PSYCKES, where to get started. So if you're a brand new agency or your agency doesn't have PSYCKES access, where to start is a great one for you. Introduction to PSYCKES. So if you came to today's training that never even heard of PSYCKES before, this might be a good training for you to attend. Using PSYCKES quality indicator reports, that's a deep dive into the MyQI reports and how you can use those to the best of your agency's ability. Navigating PSYCKES recipient search for population health. Again, another deep dive. Each of those are an hour long, so you can see that today we spent an hour just talking about the clinical summary, so you can see how much information that are available in two of those modules. I will let folks know that next week's presentation would be focusing on these types of reports for the population health management and quality assurance. The Using PSYCKES for Clinical Summary, again, that's a training webinar that we offer. It's pretty much what today's training webinar was. It's just a deep dive into the clinical summary, as well as the Consent Emergency Quality Flag, the PSYCKES Levels of Access. So those two things that we kind of already covered today. And then lastly, we have the PSYCKES mobile app for iPhones and iPads. So if you're a user who is really meeting their clients out in the community, this would be a great way for you to, on the go, using your iPhone or your iPad to pull up a clinical summary or have someone, attest to whatever level of access that you'll be able to get from them in the field and pull up that information on the go. We also have the PSYCKES user guides and short how-to videos. Those are available under the PSYCKES training material. So if you need help logging in, there's short how-to videos for that, or the user guides if you want to print out. Corin, who's on the line today, is the main impetus of updating those user guides. So that's another option that you have for your training. The self-service console, so this is important, especially for our new users. So if you've been granted access since, last April, so as of last year, ITS unrolled the self-service console as the way to manage your RSA token and PIN. Those are required for you to log into the application, such as PSYCKES. So it's for all OMH applications. And you can access that at the mytoken.ny.gov site. From within there, you can set up your security questions. So what are the security questions going to do? So if you forgot your PIN, and the PIN is required in order for you to use your token, if you forgot your PIN, you need to reset it. You have the option to do it there versus having to wait for the OMH help desk to assist you. If you've been sent a token from OMH security that now have access to PSYCKES, you can activate your token from within the self-service console. And then if, let's say, you lost your phone or you got a new phone and you need a new token, or you switch from an Android to an iPhone, you can request a replacement token from within the console as well. And that's where folks go for that. And then lastly, before I open it up to questions, if you have any questions about the PSYCKES application in regards to the functionality or to the data that you're seeing, our PSYCKES Help Desk is such a great group of people who take a shift Monday through Friday, 9 to 5. So it's for across the state. So any of our users, we have about 25,000 users. They can write in their questions into our PSYCKES Help Desk at psyches-help@omh.ny.gov, and you'll get a response within 1 business day. So sometimes questions can be a little bit tricky, right? A lot of detail, a lot of data goes into it. So even if we're not able to fully answer your question within 1 business day, you will get a response within 1 business day, letting you know that we are looking into it. So that's our PSYCKES Help Desk. If you have a question in regards to logging in, you having an issue with your token, or your security manager who needs assistance with adding someone to SMS, because OMH has multiple different applications, not just PSYCKES, those kind of tickets have to go to the ITS Help Desk. And the reason why is because they are the people who are in charge of the tokens and the logging in, because it's not just for the PSYCKES application. So if you are an OMH employee, that means that you have the @omh.ny.gov email address, right? You would be contacting the fixit@its.ny.gov email address for any of your login related issues. But if you're one of our provider partners, which basically means that you're a non-OMH employee, you would be contacting the help@its.ny.gov. And they would be the ones that would be able to assist you with logging in or an issue with your token or needing SMS support. We understand that, and again, if you do write into the PSYCKES Help Desk asking for assistance with this, we'll do our best to assist you, but we will most likely have to forward it along to our other help desks, because we can't reset pins for you and we can't look into the SMS application for you. So I'll leave this screen up while I reach out to Corin with the last couple minutes that we have on today's training. What questions can I help assist answering?
Hi, Kristen. We had a couple questions come in. So the first question is, someone would like to know, does PSYCKES show specific core and HCBS services members have received?
What a great question. And the answer is yes. Yes, they do. And that would be in the behavioral health outpatient section. So if somebody has received an HCBS or a core service, it would be listed within that section. Also in recipient search, you would have the ability to search for which of my clients have received an HCBS or core service by the specific type of service. And we might be able to go into that in more detail next week.
Okay, awesome. And then the next question we have is, are there plans to have the medication section updated weekly with the changes of the state taking over medications as of April 1st?
Oh, that's such a great question. Yeah, that's a really great question. I know that there's also some talk about those prior authorizations, and we're working right now on trying to create some sort of logic where we can help our users identify any of their clients who may require those pre-authorizations for certain medications. But to answer your question, at this point, not yet, but we're always looking to keep our data sources as updated as possible. So we'll see. It depends on when we get the medication. So if the medications are coming in that much more quickly into DOH, we would be able to display it. And I have seen medications show up within 2 weeks. So I wouldn't be surprised if that happens. We usually use like the 30 to 45 days as the cushion, because that's the average. But who knows, with this new release and this new change, it might be quicker. And I think we have time for one more question, Corin.
Okay, great. So the next question and the last question that I'll ask is, someone let us know that they wanted to use PSYCKES to ensure that they prevent duplication of services. So they wanted to know if a client already has OLP services, do they have to obtain the actual signed consent first in person or e-signature?
So I'm not familiar with what an OLP service is, and if you're worried about duplication of services, for any service, it would be listed in the clinical summary. You also have something called the utilization reports, where you can see where other clients have had some certain services at one location or others. So you can do that comparison, be like, where are we overlapping? You also have like services by any provider versus services by you as a provider. So I think maybe next week's session would be more in tune with being able to answer that. But in regards to the consent, it's just always a good policy to get consent whenever you can, because that is going to allow you for the fullest picture. So I just want to thank everybody. And for those of you who I didn't get a chance to answer your questions live today, Corin is going to be making sure to download those questions from the Q&A box, and we will comb through those and send responses to the users. Or even if we found that there's a theme, we could always send them as a part of our email to our users when it's going to include the slides and the recording, which people should expect sometime next week. So with that, I want to thank folks for joining today, and hopefully you found today's training webinar useful. Thanks again.